It's a new day, managing AAA change in an age of transformation. The purpose of this webinar is to help AAAs and their boards determine where they are organizationally and whether they need to realign or rethink their strategies in today's climate. Nationally, AAAs are moving in this direction. I am Erica Walker, the CEO of Sage Wave Consulting, and I have 20 years of experience in the aging industry, been director of geriatrics and director of a research institute that analyzed best practices and worked on business planning with the aging industry during that time. And I'm here with Gordon Walker.
Yes, thank you, Erica. I have been the AAA director in Central Virginia with the Charlottesville Area Agency on Aging called JABA. In that capacity, I had the wonderful opportunity to work with an outstanding staff as well as a board of directors that understood the value of being entrepreneurial in order to meet our mission better. And we believe that today's presentation will give you examples that we think can enable you to achieve similar outcomes.
And both Gordon and myself have worked with nonprofits, for-profits, government agencies to develop these win-win scenarios. So we welcome the chance to talk to you today about ways that you might look at your organization and move forward. Before we begin, we want to mention that Barbara Gordon, the president of SC4A and SC4A University, is very supportive of what we're accomplishing here and behind what we're accomplishing here, and we feel lucky to be partnering with them. As Barbara has written here, SC4A and SC4A University exist to support and enhance the work of area agencies on aging in the Southeast. Toward this goal, we have partnered with the Society of Certified Senior Advisors and Sage Wave Consulting to produce an educational tool that can help your organization better achieve sustainability in a rapidly changing marketplace of ideas and services. Now, this is an SC4A University partnership, and you can see here that there are 4 logos and 4 organizations that are involved. Sage Wave Consulting, which Gordon Walker and myself are representing here today and presenting this session. You have SC4A University that's overseeing all of this information and will use this as a learning tool under SC4A. And also you have the Society of Certified Senior Advisors, which is our partner with professional testing. They are hosting this webinar, and in addition, CSA is the only cross-aging industry certification nationally with over 5,000 nonprofit, for-profit, government aging industry experts that have been trained to deal with and handle and support senior individuals and senior organizations. So I'm very thankful to be here today, and I welcome the chance to work with these partners to accomplish our goals. Should you need to get a hold of us, this is our contact information, and we'll be sharing this again at the end.
And we're now going to hear from Bill Massey, a longtime friend and most capable colleague. Bill is continuing as the CEO of the PINSA Agency on Aging, which he has been doing for 30 plus years. During that course of time, he has also been on the board of the National Association of Area Agencies on Aging and was past president of the Virginia Association of AAAs. I consider Bill to be a thought leader when it comes to cultivating business-worthy partnerships, particularly related to managed care in the public and private sector. And what you will be hearing from Bill, I think, is a call to action on the part of area agencies that can achieve the same kind of value that he has been able to do in Virginia.
The future is not what it once was. Whatever the aging network thought the future would be has been dramatically altered. Governing an area agency on aging's destiny requires taking stock of the external and internal events that are influencing the business of aging. What AAAs have been doing well for more than 40 years is finally recognized as a pivotal pathway for reducing cost and loss, for curbing unnecessary medical utilization, and promoting better patient outcomes and customer satisfaction. Through timely advocacy, planning, and service delivery, AAAs have forged a networked safety net for seniors and family caregivers, frequently doing so as financial resources have failed to keep pace with demand caused by an expanding list of compelling factors. a growing customer base, healthcare economics, an overtaxed family support system, rapidly evolving technology, and government unpredictability have intersected to drive the need not only for substantive change, but also to realize future growth opportunity. Who has more experience in the enterprise of aging than area agencies on aging? We've been imaginative, but not generally successful, scaling that innovation and bringing those ideas and products to market. The same mission-motivated spirit and ingenuity that has enabled AAAs to maximize resources, to achieve community leadership, and to achieve resourceful partnerships can respond favorably to evolving customer values and behaviors. What were once perceived as barriers can now be viewed as open doors to increase organizational efficiency, heighten the community's readiness, and increase revenue diversity in a marketplace of possibility.
SE4A has been working with Sage Wave Consulting and SCSA for a couple of years now. And during that time, Gordon and myself worked with SE4A to create a survey to ask the leaders of the AAA membership what they feel is the important need within their organizations. What kind of courses, what kind of classes, what kind of training needs do they have? What are their strengths? What are the areas that they feel that they need more expertise in? And out of that, these two main objectives came forward: build business acumen and develop strengths working with health plans. And so this is a natural theme that is happening across the country, and the SE4A membership is right there with it, wanting to move forward in this direction. And as a result of those two priorities, Gordon and I have believed that the best way for us to help you to understand how to address the needs within your organization is to focus on the business development cycle. And you can see here that there are 6 major areas that you would want to look at within your organization. You might want to take each of these areas as we're going through the webinar separately, and maybe even if you can, stop the webinar and analyze it and have a little reflection and brainstorming within your organization as you're looking at each of these areas to think about what needs to be revisited, regardless of whether you're a government agency or a nonprofit or where you are today or whether you're partnering already. You probably need to revisit at least 1 or 2 of these areas. So we're going to start today by presenting a section on identifying the need and why. Then we're going to move to opportunities and solutions and talk to you about the what, who, and how. We're going to look nationally on what best practices and what the leaders in AAAs are doing across the country by looking at lessons learned, doing a national and local scan. Then we're going to make some suggestions for you on ways to look internally and audit your culture, your resources, and your sustainability. And we're going to make recommendations for a strategic plan and how you might look at creating a blueprint for success as you move forward. And finally, in my opinion, one of the most important parts, implementation. Who's going to take the responsibility for implementing your goals and directions as you move forward and realign what you're doing within the organization? So let's move to step 1, the business development cycle, identifying the need and why.
I would expect that the particulars within this slide do not come as a surprise to most of you, since this is the world of a AAA director and being on the board of a AAA. The picture, I encourage you to think first of who are the decision makers within your organization, and they're both internal and external. You've got the board of directors, you have AAA management, you have staff, but you also have funding sources. These existing conditions can be perceived as threats or opportunities. The external and internal influencers represented in the slide present a diversity of interconnected variables that impact the ecosystem of area agencies on aging. So regardless of your organization's size, geography, or corporate structure, a familiarity with what effect these situations have on current and future operations, as well as your expectations, is necessary for making prudent decisions about programmatic priorities and resource allocations. Not all organizations are necessarily ready to pursue business opportunities, but thoughtful analysis of your options can be done by all AAAs.
And as Gordon had mentioned, it's really critical that you think both externally and internally. We all know what the political climate is going through right now, and the local, state, and federal funding and the healthcare changes that are going on externally. But we also have internal issues that you need to face under the AAA world. You may have staff turnover that's happening, succession planning you need to think about. How do you make sure that everyone's trained and where they need to be? Who are the customers that you want to deal as more of an external perspective? But do the people internally understand what it means to deal with those customers and the kinds of changes that you have? So there's a lot of variables here, and I think it's critical that you think of each of these little bubbles as a separate issue that you need to address carefully.
A primary consideration is to think how demographic changes can benefit AAAs. No doubt the 65 plus growth spurt will have more people finding their way to your doorstep. And in particular, the fact that the persons over the age of 85 is the fastest growing sector of the population, and they have social and healthcare needs that are a common denominator regardless of person's social or economic status. And you will be prepared, as you have been, to better serve that population. Also, it's recognized that the older population is growing more diverse with varied backgrounds and cultural values. More older adults have no children. In fact, baby boomers, 25% chose to have no children, and another 25% only have one child. You add to this the fact that 40% of women over the age of 65 live alone, primarily due to higher divorce rates than previous generations, the fact that women still outlive men, so they outlive their spouse, or decided never to marry in the first place. But there's a greater dependence on the community support system as a result of having elders without adult children, or that they're living alone without having a natural support system close at hand. We add to this that family caregivers may not be living close by, and adult children, as the backbone of the caregiving system, can be sandwiched between care of kids as well as their parents. Additionally, persons living longer with chronic illness means caregiving can be a long-term job for a family. It's not just a short stay. It's not just a short obligation. It can be over a period of a long time. And so that puts more strain on that informal support system, but again, raises the value and importance of having a formal support system that can complement the family caregiver. It's also essential for AAAs to think about how they can be responsive to the more active senior. Existing and future older consumers expect their communities to meet their social, health, and recreational expectations, while also recognizing and enabling their abilities to be contributors to the greater good as productive volunteers, as paid employees, and also as small business owners. The varied business structures of AAAs, with about them evenly split between being nonprofit and being part and parcel of the local government, whether it's just one locality or regional, sets you up to respond favorably to the demographic transitions we've just discussed.
So let's now move to the next step in the business development cycle, step 2, opportunities and solutions.
Many AAAs do not acknowledge and market sufficiently the unique value proposition that they can offer future customers, and I must say, business partners as well. A value proposition is a company asset that can convincingly put forward why your organization is good at what it does and perhaps even better than the competition. When clearly articulated, your highly regarded experiences can create a powerful, positive identity for your agency's brand. These attributes include knowing your clients very well, knowledge of the local social service and health service network, and the respective track records. You know who is good at doing what they said they do, and that can be of great value to any consumer. As a result of effective advocacy, your clients have received improved policies and services. Inasmuch as the necessity is the mother of invention, AAAs have learned how to be innovative, meeting client needs. Additionally, I would add, by having access to seniors and their caregivers in their homes, you have witnessed real-life experiences and thus have seen firsthand the complexities associated with the delivery of timely and quality services. As a result, the data your organization has collected from doing this work can help target scarce resources to have the best patient outcomes. And lastly, the reality that the services you render have been proven to reduce financial burden on families, government, and private insurers. Add up all these AAA virtues, and you can make a compelling and robust case why you can become a partner of choice.
So you have a tremendous amount to offer. There's clearly there. We understand that. You're in the home. You see the person day in and day out. You know their needs. As Gordon has mentioned, you know the family dynamics, you know the financial situation, but you know also that in order to meet the sustainability needs of your organization, you have to learn and expand your expertise. You'll notice that the orange subtitle here says attracting customers and keeping clients. And we purposely put both of those words in there, customers and clients. Often nonprofits think of their individuals that they serve as clients, and you often hear for-profits calling them customers. And there seems to be a bit of a challenge between those two words. And a different way that people approach them, at least perceived to be approaching them. I suggest that you look at those two words, clients and customers, and think about how you approach the individuals that you serve and making sure that you're meeting their needs as both a client and a customer. In starting to expand your expertise, first step I would look at is strategic planning. Do you have one? Do you need one? If you have one that is in existence, we're going to talk a little bit more about how you might approach it. If you don't have one, it's time for you to start thinking about what you actually need. And as you're expanding your customers or your clients, do you need to realign your marketing plan? Do you need to clarify which direction that you want to go in and who your market is? And you're not just talking about seniors themselves or caregivers themselves. Your market is also the other businesses that you are competing with or marketing with or partnering with that you're serving within the community. So they are also your customers and your clients. And do you have the expertise that you need to serve that population? Oftentimes people need additional skills, need additional training in order to meet this new direction that they're taking within their organization. Again, I would like to suggest that you think about some of SE4A University's clients that they are working with, some of the people that they've hired to help with training, such as Elsevier and SCSA and other organizations. Partnering. How do you find the right ones? As you're looking in your community, we're going to talk about this a little bit more. How do you identify who you should be partnering with? And as you're developing your services and business, how do you realign your existing services? You don't necessarily have to start new services or new directions. You may just need to fine-tune or realign the existing services that you have. And finally, data collection and evaluation. Every AAA has a requirement to collect data and to evaluate the situation through the Older Americans Act or through other funders within their organization. But if you are really realigning yourselves and looking outside your walls at other for-profits or other managed care companies or insurance companies to partner with or healthcare systems, do you understand the data that they require as they move forward, and are you also collecting that similar data? For example, in healthcare, they look at reduced readmissions and ER visits, patient satisfaction and safety, effectiveness of care, and they also have a very strong priority now on integrated care, which is one of your expertise as a AAA. So you need to look at all of these areas as you're moving forward in determining what direction you're going to take. And as we think about this, there's already a lot going on with AAAs across the country. I just came from the American Society on Aging conference in Chicago, and there are multiple sessions that are focused on managed care. That seems to be the priority right now for AAAs and government agencies, collaborating with managed care, and clearly the political direction and the healthcare direction has moved things in that way. There were over 300 people that attended a managed care summit at the ASA conference, and there were a lot of opportunities to learn from each other on what's going on and what AAAs are doing. So that's one of the first areas that I see as a priority for you if you have not considered it, and as an opportunity. Now, that's not the only direction you should be thinking about, though. as you diversify your organization, it's clear that you cannot just count on government for supported revenue. You need to look outside of government, and that many organizations, AAAs right now, are looking at partnering with hospitals, physicians, home health agencies, and they're also looking at and partnering with employers, healthcare, and social services. Whether they're looking at doing intake evaluations, whether they're looking at working with EAP programs, whether they're looking at transitional care, all of those are areas that are really strong right now. And the goal is obviously to make sure that you're providing the support that's needed and that it's a win-win for both of you. Providing information and referrals, there's definite ways for you to move forward as you're providing information and referrals. Again, intake evaluations, database, consulting, vetting, connecting with benefits and services. Those are all strengths that AAAs have and that they're using to develop and realign their businesses. Finally, when you look at business development on the for-profit side, 22% of AAAs serve private pay customers. 29% are building private pay systems, and 29% are using cost sharing, which are voluntary contributions to supplement their existing revenue. And it's clear that you need to think about all these areas along with service contracts as you look to build upon your existing organizations. Okay, let's look at business development cycle step 3, lessons learned on the national and local level. This section will focus on talking about what's existing in more specifics so that we can give you some examples of what's working and working well.
What we have here is a scorecard of the many constructive relationships AAAs have had working as a team player. By being innovative and resourceful, area agencies on aging, out of necessity and also altruism, have formed multiple formal and informal partnerships. These collaborative activities have improved delivery of essential services, thus meeting a benevolent bottom line. Eric and I maintain this productive tradition of working together with a common purpose can translate into serving a dual bottom line of doing well financially while doing good for your community. Furthermore, the time is now to make strategic partnership decisions about your future revenue growth opportunities.
So this is an important slide as well. And again, I suggest that you take this and analyze it and spend some time reflecting upon it. Oftentimes, we as AAAs and those that are working in the industry are a little nervous about spreading their wings outside their doors and partnering with others. They think of them as competitors. The for-profit world, you may think of it as a competitor, the healthcare system as a competitor. But we would like to suggest, Gordon and I would like to suggest that you rethink that concept. Are they really competitors or are they your business partners? If you look here, you'll see that there are tremendous business opportunities. These are all the services in the little bubbles that you provide and that you have available to you. And some of the people that you're looking to partner with have those same services. You have similar clients or customers. You have similar services. You might have focuses on wellness or aging in place. And those are already ideas and concepts that you should be able to build upon as you move forward. Now, you also have opportunities. You have a strength as a AAA that you can carry and offer to others that they would value. You can help them to reduce their cost and increase their quality by providing your service. You can help them to merge an interdisciplinary business model, moving for-profits and nonprofits together so that you can expand your customer base to all economic levels. You're going to hear about an example of where a AAA serves as a one-stop shop. Because you're an objective third party that vets these services that are available in the community for older adults and caregivers, people want to use you as a referral source to help to link transitional care, and you have an opportunity there. You are the neutral broker of services. And you also have the ability to collect and interpret data, which is valuable to all your partners. At the same time, you want to work on sustainability and building your earned income. As Gordon says, you want to look for an eHarmony match. And that's what we suggest as you go out in the community is think, who matches well with our mission, and how can we expand our mission to meet that need. Now, this slide very well identifies that there's a whole world out there that I suggest you need to think about. Don't isolate yourselves from the for-profit world. Again, I remind you, I went to the American Society on Aging conference, which I've done multiple times, and right in the middle of that 5-day conference, there's a 1-day session called the Boomer Business Summit. And typically there's about 400 to 500 people. It's put on by Mary Furlong and Associates. And the majority of the people that attend that session are the for-profit world, but there are also government and nonprofits and AAAs there, but very few. And I want to suggest to you that you need to think about attending those types of events. There were some tremendous opportunities that are out there that are already providing some of the same services that you are. For example, one partnership was Holiday Retirement Senior Living that was partnering with Great Call and United Healthcare to help to keep people in the home and stay aging in place. And for those of you who do not know, Great Call is the jitterbug phone with the larger usage for older adults so that they can use it easier. It provides an easier format for people to use phones. They have set up a system with this organization that allows people to simply push a button and get access to the care that they need. Also, another AAA example, which I'll talk about a little bit more, is Elder Services of Merrimack Valley and Senior Link, and they're working together, and I'll talk about that a little bit more. But I strongly suggest that you start looking outside of the nonprofit and government conference world and start looking at the for-profit aging industry world and figure out ways that you can identify with them and build relationships with them and find out what they are doing.
I had kidded with Erica that I thought that previous slide looked like a uniform of a NASCAR driver, but it does present ample indication of the various businesses out there that are looking for an organization such as a AAA to do business with. And when we have made the decision to engage in revenue generating opportunities, this naturally leads to evaluating what is the preferred business framework among the various options available to you. Generally, higher risk is associated with those pathways that present greater financial reward. A nonprofit can create a for-profit entity on its own or share the risk in capital investment with either a for-profit or another nonprofit. The purpose can be to offer a new product or technology, such as a helpful app, a new piece of medical equipment, or a care coordinating software program. Certainly, managed care is providing possibilities for AAAs to partner with both nonprofit and for-profit hospital systems. These can be strictly contractual with minimal risk or can require shared capital investment. The services offered for a fee can generate revenue, much like Paul Newman Foods, where those that can afford to purchase a market rate product provides revenue for charitable causes for persons unable to meet the market rate cost of a service they require. When entering business partnerships that require equity participation, it is helpful to remember the value of your well-earned reputation. Your positive brand in the community has real dollar value, and it can represent your equity share in a capital contribution form. All of these business design opportunities do not mean mission creep. They are the realization that mission can be achieved by thinking and being entrepreneurial. From SE4A's newest member state, Virginia, comes a proven, unique, and comprehensive illustration of what AAAs are capable of doing when they put their collective minds together. What started as a CMS-sponsored pilot project with funding from one AAA, Bay Aging, soon included Peninsula AAA and spread to become a one-stop partnership of 5 area agencies on aging, 4 health systems, 11 hospitals, and 69 skilled nursing facilities. Known as the Eastern Virginia Care Transitions Partnership, its huge success of significantly reducing hospital readmissions among a very high-risk population, thus lowering cost and improving patient health, became the first statewide collaboration of AAAs, now called the AAA Cares. It identifies the root causes of poor patient outcomes, then provides timely, transitional, and coordinated care that blend a potpourri of services, including evidence-based prevention programs. This award-winning approach has led to substantive Medicare and Medicaid savings at the national level and within Virginia. The states of Pennsylvania, Ohio, and California, as well as the American Health Insurance Plans Association, have sought the advice of Bill Massey, the Director of Peninsula Agency on Aging, and his counterpart, Kathy Vesely of Bay Aging. This population health pie chart was developed by Dr. Robert Schreiber, who is on the faculty of Harvard Medical School. It shows that social determinants of health, such as housing, lifestyle choices, and social economic status, far outweigh clinical care as factors impacting on one's health conditions. The point being made here, and as shown, is that a lot of key AAA value propositions that your organization has the capacity and the expertise to deliver essential non-clinical services and supports. Further testament of the value and benefits of the AAA Cares is its endorsement by U.S. Senator Mark Warner, shown here displaying the VAAA Cares brochure while promoting its successful outcomes to his colleagues in the U.S. Senate.
Okay, and that is one example of AAA's working with managed care. There are many other examples. I had mentioned earlier Elder Services of the Merrimack Valley. And please realize that this is a diverse rural and suburban geographic area. So a lot of times when I do planning and strategic planning with AAAs, they mention that we have a large rural population or we have a large urban population that we serve, and it's difficult for us to find solutions as a result of that. This is one example that has both rural and suburban geographic area that I believe does a good job of showing that there's ways to be successful as you move forward. They are currently doing a great job of proving their value with managed care by bringing in more revenue from that direction. And as you see here on this slide, the Elder Services of the Merrimack Valley, before and after, between 2006 and 2015, they have doubled their budget, they have doubled their staff, and they have increased their grants and contracts by about $15.5 million. And you can see from the pie charts that the state funding, government funding is much less in 2015 than it was in 2006. So contracts have jumped from 4% of their operational budget to 29%. So there are ways to be successful, and they would welcome the opportunity to talk to you about that. At the same time, they, as I mentioned earlier, are also partnering with Senior Link to help to promote their caregivers as an opportunity to connect through Senior Link's network. And so they're doing a great job of that as well. Other AAAs in managed care, again, this is a national trend that's growing. You have Virginia, you've got Ohio, you've got the state of Washington, New York, 6 Iowa AAAs are working together, San Francisco Bay Area, and Marin Center for Independent Living in California. These are just 7 different examples, but there's many more that are out there. And perhaps you are already working in that area and you just want to continue to grow, or you want to continue to expand your managed care presence. These are all great resources for you as you move forward. Now we're going to switch over. We're not just going to talk about managed care. We want you to think about also partnering with for-profits as you move forward to make sure you have a diverse economic stream.
What we have here is an illustration that hits close to home, since this occurred while I was the AAA director in Charlottesville and continues to this day. It is an example of where you can blend together the interest of a AAA with that of a for-profits business plan. Care Advantage was based and started in Richmond, Virginia, and decided it wanted to expand into the planning and service area of JAVA, the Jefferson Area Board for Aging. Soon enough, discussions led to a recognition of mutual benefit. It would enable JAVA to expand its customer base, enrich our mission capacity, in other words, have more revenue to meet our purpose, and we were able to share software efficiencies. For Care Advantage, it was an instant marketing advantage to be able to co-brand its services with Jabba's, provided Jabba with an operating partner with a lot of experience and more than we quite frankly had in the arena of home care. And they've therefore received a management fee. And it also demonstrated to the general public that here was a for-profit that placed significant emphasis on doing social good will at the same time they could create greater sales revenue. We decided to call it Care Advantage Plus, and over a period of 15 years, it generated $2 million in profit for Jabba, which enabled us to expand our continuum of care, and as our staff used to say, it enabled them to say yes more often than no when being met with a service need, and it enabled Jabba to increase the number of persons with low income we could serve. And in the arena of housing, here is another example of how partnering with a for-profit provider of senior housing can bring much needed affordable housing to a community. And this is housing being complemented by services. In this instance, and a few others, Jabba has had the opportunity to pursue, was a low-income housing tax credit finance product. The result has been, from these activities, 240 units of affordable senior housing co-owned by Jabba, with an emphasis on enabling longer-lived aging-in-place opportunity for the residents, and at the same time, it increased the Area Agency on Aging's asset base. In the current senior housing marketplace, you may know of instances where retirement housing companies are expanding their customer base by providing community-based in-home services to build corporate goodwill and brand loyalty. AAAs are in an advantageous position to construct service and revenue sharing partnerships with these retirement communities to create a new business model. To summarize, there is a plethora of innovative startups waking up to the senior marketplace, utilizing technology and the sharing economy. Transportation, care coordination, and in-home services in particular are some of these business startups' objectives. These initiatives can spell either gloomy hard times for you or blooming good times for AAAs. Eric and I asked the question, what will it be for your organization?
We've given you a few ideas on how to identify the need and why, some opportunities and solutions, and some national models that you can look at and think about. Now we're going to move to step 4. It's time for you to look internally and think about what's realistic for your organization. What are your current values and what can you expect to happen within your organization? First, let's look at your organization. Are you ready? Are you ready to realign? Are you ready to expand what you're doing now? Are you ready to reinvent yourself? You have to look at 4 key areas. First, your leadership. Do you have an engaged and committed CEO and board? And that, to me, is a critical aspect. If your board is not behind you as you're moving forward, and they're not an active board that has a strong desire and enthusiasm to help you accomplish your goals, then I think you need to reflect and rethink of what you need to do. And that goes for your CEO too. Where are you with your CEO? And those are hard questions to ask, especially as you're in the audience listening to this webinar right now. Readiness. Are you prepared to take action? Look at your staff, look at your volunteers, and look at your partners. Are they where they need to be right now? Are they ready to move forward? Do you have the capacity and available resources to move forward? Sometimes people say, I can barely hang on. I've got a waiting list right now. I don't want to expand. I don't want to redirect my organization. I just can't handle it. Well, think of it on the opposite side of that opportunity. What if you did partner with someone that could actually increase your capacity and help you to have more available resources as a result? Those are things that you need to analyze whether you have an opportunity to move forward in that direction. Finally, your culture. The people that are working with you, do they have an entrepreneurial spirit? Are they willing to get out there and try new things and take a risk and make it work? Are they open to change? It's critical that you think in all of these areas as you move forward. And if you're not ready, ask yourself why. What do you need to do to get ready?
So how can a board, or you as a board member, make a discernible difference that adds value to your organization? To begin to answer this question, we recommend an annual board checkup, a self-evaluation that examines your administrative, creative, and fiscal health. Such a review will recognize strengths as well as diagnose areas needing treatment. Usually each board member is asked to respond to the questions you see here on this slide, as well as others that can lead to new insights and thoughtful solutions. The individual and cumulative responses from doing this self-exam are used to underscore priorities and fill gaps in leadership and lead to appropriate policy making and planning. Being proactive with the results can enhance your capacity to strategically meet a board's fiduciary and social responsibility.
So you have some thinking to do. You've got to work with your board and evaluate your board. Are they involved? Assess where they are and where your skills need to be maybe beefed up a little bit. Once you have approached that, maybe the next step is to move to step 5, the business development cycle. Look at your strategic plan. Where is your strategic plan? Is it sitting on the shelf getting dust? Do you pull it off very often and reflect upon it? Is it time to throw it away and start again? Oftentimes when I'm involved in doing strategic planning or in helping boards to analyze their next direction, and I'm sure, Gordon, you're the same way, you find that people don't really use the strategic plan very much, and they're not even sure maybe where the strategic plan is. So we're going to recommend that you think about moving in that direction. And Bill Massey, again, is going to help us by helping you to get started in how to integrate this needed change in your environment.
What was once perceived a divide between for-profits and not-for-profits is now viewed as a win-win alignment of the two. An area agency on aging's business appeal and competitive capacity relies on the wholehearted endorsement of its governing board, be they elected officials or volunteer appointees. Senior management alone cannot do the job that needs to be done. An enterprising board of directors will roll up its sleeves and assist actively in the pursuit of strategic business opportunities, enabling mission growth to be more accountable in the best interests of key stakeholders. Stakeholders like clients, their families, other providers, and traditional funding sources. With an open mind, boards can grasp a better understanding of where the healthcare and services industries are going, agree the AAA is open for business, and commit the resources necessary for long-term sustainability. Similar to the attributes desired of staff, a board's talent pool should include members who are creative and motivated to move the organization forward, willing to take measured risk, and also willing to share their organization's legacy brand with prospective partners. This business-savvy approach will create favorable conditions to increase overall agency efficiency and be more impactful and increase human and financial resource capabilities. In other words, be better able to fulfill mission with a more encompassing vision. Moving in this direction is more than just an urgent necessity. It is also a strategic responsibility.
Bill has given you some good ideas, and he's not the only one that's using these ideas. As you can see from this chart back in 2015 done by the Gerontological Society of America and presented at a national conference, many AAAs are implementing business development and sustainability strategies. And you need to ask yourself, have you looked at your marketing services, as 70% of the population of AAAs have? Have you developed a multi-year strategic plan, as 61% have? Are you developing grants and working to build upon those grants? Are you expanding your type of services that you're offering or realigning your services? Do you have enough staff? Do you have fiscally sustainable programs? Is each program sustainable in its own? If not, you may want to revisit why it's not sustainable and figure out ways that you can make it sustainable. And have you considered private pay practices in your environment? Maybe it's time for you to look for partners or look for opportunities to build upon that. And there are specific keys to successful partnerships. I know that Gordon mentioned earlier that it's time for you to think about looking at your value propositions and figuring out ways that you can develop a win-win in a two-way direction. What do you have that other partnerships or other organizations want? And what do they have that you want? And that's the very first question I would sit down before even venturing out to do a partnership. What do they have that you want? And what do you have that they want? And then you need to take time to focus on building that relationship. I've seen organizations that develop a whole plan of action and go in, and their very first or second meeting with a potential partner, they've got a plan of action with them. That's not a great way to do it unless you really have a partner that's open and willing and flexible. They want to feel part of this solution. So you have to take time to get to know them. Invite them out to lunch, meet them for coffee, talk about their organization, visit them at their location, join their boards, volunteer with them, join network groups together, and put your needs on the back burner as you get to know them, and be patient. As you're developing your successful partnerships, there's going to be delays. You can set a timeline that is realistic or unrealistic, or maybe you think it's realistic, and guess what? You might have to adapt it and extend it. That's okay. You've got to be flexible and willing to work in that direction. Another key is learning to integrate their language and measurements. Gordon and I have created a tool that looks at for-profits and AAAs and identifies the difference between the way they look at decision makers, their financial outcomes, they measure their outcomes and objectives, the way they approach their customers, different acronyms they use, such as return on investment versus CLTC and ADRC. Do each of you understand the difference between those acronyms? Timelines. Different people have different needs for doing things quicker or slower based upon the organization. Staffing positions. There's different names for the different organizations. Do you have CEOs, executive directors, vice presidents, counselors, marketing directors? You have to understand that. And there's trigger words. Oftentimes I come into a situation where nonprofits are averse to the word profit. They think all that for-profits are about is making money. And clearly they have to make money in order to keep their doors open, but it's something that all organizations have to do. And so you have to consider that. And then there's certain hotspots such as competition or staffing or waiting lists that each type of organization has as you move forward. So those are things that you must consider. And then as you're building a partnership, what's the risk if you get connected with this organization? What are the risks that you have? Can you afford to be transparent with them? And maybe not with all of your information, but with the majority of your information. Can you be transparent with that organization? You have to evaluate that before going out to build that partnership. Again, I suggest that you take time and reevaluate that as you go along. All right, moving to step 6, the business development cycle. Implementation, roles, responsibilities, and actions. Oftentimes when I've worked with organizations, they get to this point, and that's when that strategic plan goes on the shelf and collects dust. People do not want to take responsibility to make something happen. So I am suggesting that you use this next slide like your Bible. I even made it in the format of a plaque. And if I could hand you a plaque, I'd hand you a plaque with this slide. Make sure you're consistently looking back at it as you implement your goals and objectives and you implement your new directions within your organization. You don't have to go outside of your mission, but it's easy to do if you're looking to develop revenue and be sustainable. Maybe you provide transportation, but do you want to be a transportation organization? Be careful not to turn that into your primary service in the interest of getting more funding. Be passionate about the direction that you're going. Take a long-term perspective. A lot of times people look at the short-term fix and the short-term crisis and address that. And in the interest of doing that, they don't create a sustainable organization. Follow your strategic and business plan. Pull it out and look at it consistently. And is it still valuable? Do you need to realign it? Do you need to readjust it? It is a living document. Educate all your stakeholders. I've worked with situations where people educated the board and the staff, but they didn't do a good job of educating their partners or making sure their partners were educating their staff and their board. Everybody needs to know where you are and where the progress is and what the issues are. And prepare for the unexpected. Competition is consistently growing. Partners are consistently growing. The aging industry is consistently growing. You need to realize that there are other people developing services at the same time you are, and you need to be ready to adapt and to welcome them into your fold and figure out opportunities so that you can have the value proposition that is the most valuable for your partners and for the people that you're working with. Be flexible and persistent.
As noted earlier, I had the good fortune to have a board of directors that recognize that fostering and advancing an entrepreneurial culture is a necessary role for a board of directors. Noted management guru Peter Trucker defines such a business-like environment as one that identifies and acknowledges change, responds to it, and exploits it as an opportunity. Here are several ways a board of directors and its members individually can do meaningful work that also creates impact and achieves sustainability over the long term. Number one, recognize and accept that profit is not a dirty word. It is what is done with that profit that determines its true worth. As a AAA, you are creating social capital that does good in the community. That is admirable use of any profit. You can be an active player. Don't be satisfied sitting on the sideline as a board member when business opportunities present themselves. You can set a positive and inviting tone for the organization. In such a manner, you are letting the community know you are open for business. Thirdly, communicate with and advocate for local government support of your organization's effort to diversify its revenue base. In the case of JABA, which was created by 6 local governments within our region, it was necessary for the board to receive the endorsement of each of these local governments. Each one encouraged us to go forward with forming a recommended corporation that would pursue fee-based services. They recognized that our success would better enable them to serve their constituency, particularly those people that lived within their communities that could not afford market rate services. Also, as a board member, you can be the #1 salesperson of your AAA's unique value proposition. Also, be certain to commit the resources that are necessary in order to get the job done. What we're talking about here, optimal time for you and your senior management to develop and pursue the opportunities that are offered in your community. Also, work with them to allocate some money and to locate the talent that can lead to relevant and powerful solutions. In the case of JABA, doing a self-evaluation, it recognized it needed to recruit board members for this new affiliate organization that had successful corporate background. And we were able to attract them because they too were dealing with aging issues in their families, and they recognized the value of what we did. Also, having senior management with for-profit business experience is a real plus. You may already have this talent on board, or you may have to go out and recruit it. In the case of JABA, we had a CFO with banking experience, and in fact, my successor is somebody that came from the private corporate sector. The advancement of these capacity development principles will lead to practicing management of the possible, thereby enabling you to be better able to fulfill your mission by way of an improved vision.
So, are you ready to do business? We would suggest that nothing's going to happen if no one is responsible, or there's no timelines, or there's limited buy-in. So you need to take the opportunity to move forward. If you cannot do it yourself, there are wonderful organizations out there that can help you, similar to Sage Wave Consulting and other consultants across the country. SC4A University has resources that can help you. SCSA has training and certifications that can help you. But you need to look at these bullet points internally and figure out where you are first. Are you ready? Do you want to look at your existing resources and build upon them? I suggest that you are at a turning point. AAAs in general are at a turning point right now. And if you are planning to put this off and your sustainability is an issue, I think that you might want to reconsider. And I'm not trying to scare anybody. I just think that it's a good time for you to take this seriously and move forward and determine what your next steps are going to be. You should look at your market, look at the opportunity out there in your market. You should develop value propositions and goals. You should build relationships with your partners and stakeholders and invest in training and strategic planning. And for heaven's sake, assign responsibility to someone. Develop action items, develop timelines, and make somebody be responsible to accomplish those goals, being flexible and realizing that they maybe have to be adapted as time goes on. And finally, assign project managers and tie it to their incentives. That will help to motivate people to get these goals done as they move forward. You have the power as the administration and as the board to make a difference within your organization. So Gordon and I suggest that it is a new day, and that where there's a will, there's a way. And SC4A University is here to help you along that line, and so are all the other organizations that are part of this board webinar. And we welcome the chance to help you further. Thank you for the opportunity today, and we wish you well in your endeavors.
Yes, you can do it.